Welcome to a podcast brought to you by the American Academy of Orthopaedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello, my name is Stephen Shaffer, and I'm honored to bring to you a conversation with both Dr. Elaine Lonnemann and Dr. Stanley Paris. In this podcast extra, we're going to wrap up our brief series of interviews regarding the forthcoming vote to potentially change the name of IFOMPT. As regular listeners will already know, the proposal seeks to change the Orthopaedic Manipulative portion of IFOMPT's name to of Musculoskeletal. While listeners likely do not require any clarification, let me state for the record that Dr. Lonnemann is joining us today because she is the president of our academy. Dr. Paris, on the other hand, is here in his capacity both as a co-founder and past president of IFOMPT. This is guaranteed to be a conversation worth listening to, so let's get to the interview and see what we can learn. Dr. Lonnemann, welcome to the podcast. How are you doing today?
I'm doing fantastic. Thank you for asking me, and it is certainly a pleasure to be here to represent AAOMPT.
And Dr. Paris, a warm welcome to you as well. How are you doing today?
Oh, I'm fine, thank you. Looking forward to this opportunity to communicate.
It is spectacular to have you both here as guests today, so thank you to both of you for joining us. And why don't we just jump right in, and let's approach this from a timeline perspective. So let's go to the further back in history perspective first. That is, Dr. Paris, as a co-founder and past president of IFOMPT, what is your opinion on the current proposed name change within IFOMPT?
I'm absolutely opposed to it. When we, the founders, first met in London in 1967, and then when we incorporated IFOMPT in Montreal in 1974, we were all about raising the standards of joint manipulation, where it become accepted practice within physical therapy, which it was not at that time. We were not about orthopedic or musculoskeletal or sports. We were about manipulation. The only reason we added the word orthopedic is that if we formed an organization called International Federation of Manipulative Therapy, some could think that was to do with psychology. So we put the word orthopedic in there to make sure that it was related to this field specifically. Now, the danger in my mind of moving to musculoskeletal is that less and less programming, and we've seen this in recent years, less and less programming at our international congresses will be devoted to manual and manipulative therapy. And as a result, those interested in this field will not attend those meetings. And I'm afraid that this lack of attention to this field will put manipulative therapy into the back seat. And I think we should be, and we certainly here in America with AAOMPT, we have an orthopedic section taking care of musculoskeletal. We have a sports section, and we have AAOMPT with 3,000 members as opposed to orthopedics 20,000. We have AAOMPT specializing in manual and manipulative therapy to sustain and advance it. And that's why we founded IFOMPT, and that's what we should be fighting to maintain.
And Stephen, I think the other thing I would add in terms of timeline, when IFOMPT was developed, they also not only wanted to convene and be specific about manipulative physical therapy, but also provide an opportunity for research specific to that area, of course, clinical practice and conferences that focused on not only technique, but really about how to treat the whole person and to develop the educational standards. That is one of the reasons why there are so many countries who want to be part of this. We are really excited about having an international presence, an international conference where we can work with individuals from around the world in a topic that we love and in a treatment approach area that we feel is really important for our patients.
Those are all great points. Thank you for sharing them. And Dr. Lonnemann, as our president, I don't think there's anyone who could speak more accurately about how this potential name change could impact the academy. So what is your opinion in particular on the name change or proposed name change, and what it could mean for us as the American Academy of orthopedic manual physical therapists?
Happy to speak about that. And I will speak also for the AAOMPT board. We've had long discussions concerning this topic and our concern about the IFOMPT executive bringing this forward. We understand that they feel there was a mandate to bring this forward, this motion. I'm not sure where the mandate came from, and neither is the rest of the board, but we think it would impact AAOMPT negatively for several reasons. First, whenever they came over in 2016 and presented at our AAOMPT conference, they presented on the definition of what orthopedic manual physical therapy is, and they presented it as an approach. And AAOMPT really embraced that definition to the extent that it's part of our mission as a group that is specialized or is a subspecialty in OMPT. Our mission is excellence in the specialty of OMPT. Our mission isn't related to just musculoskeletal physical therapy. So I think that's a big impact when your mission focuses on OMPT, and we want to be part of an international group that focuses on OMPT. Changing to a more generic name represents a different group of physical therapists. And we've worked really hard to develop our subspecialty. We've even developed a foundation in orthopedic manual physical therapy. And we want to be part of an international group that focuses, as I mentioned, on the educational standards, the research, clinical practice, and advocates for manipulative and manual physical therapy.
I can understand how the present executive may feel that we need a musculoskeletal group within world physiotherapy. We certainly have musculoskeletal group within American physical therapy, given the orthopedic section and the sports medicine section. But they should go form their own organization if they want to have a musculoskeletal. I think it's needed within world physiotherapy, but they shouldn't be hijacking an organization such as IFOMPT, which was created specifically for manual and manipulative therapy.
Part of what I think I'm hearing is that if we, within physical therapy, do not have a dedicated space for manual and manipulative therapy, which we all know involves more than just manual therapy, but it's a huge component, then we might get squeezed out of the spaces that we currently call home.
It will be very divisive, and I can be pretty sure that America will give serious consideration to leaving IFOMPT and joining another body, international, such as a FIOMPT, a Federation International Orthopaedic Manipulative Therapy, to address our specific interest in sustaining and advancing manual and manipulative practice. General musculoskeletal is a different area. It's a much broader area. We're a very small subsection of that, but we want to keep it alive. We think historically and in the future, hands-on physical therapy will always be necessary and an essential part of healthcare. And who better to provide that than physical therapists?
The other impact is that our national association supports us, and we are the representative to IFOMPT that the American Physical Therapy Association, they put us forward as their group. We're partners with the American Physical Therapy Association. And I've already had conversations with the board. They've asked questions about this potential name change and have said, we have our orthopedic or a group that represents musculoskeletal physical therapy, or several groups actually. And, what are the implications of that? Why wouldn't we put our own musculoskeletal groups forward to an international body that embraces musculoskeletal physical therapy? And so I think that's also important to understand our national implications. I think the other point that IFOMPT has brought about is that the World Health Organization definition of musculoskeletal is something that they want to embrace. And musculoskeletal from a World Health Organization is a very broad term. I mean, it includes individuals with osteoarthritis, patients with amputations, individuals who have low back pain and rheumatoid arthritis, osteoporosis. Obviously, those are patients that we treat, but there are a lot of subspecialties in those areas that are already present in the American Physical Therapy Association. And so this would really broaden the expanse of IFOMPT, which, as Dr. Paris mentioned, that's maybe a good thing to some extent. But I agree. I think we will lose our focus and a subspecialty that we've worked hard to define in our description of advanced specialty and fellowship practice.
These have all been excellent points. Thank you very much. As we begin to close out, are there any final arguments or statements that you think that we should make?
Well, I really want the listeners to remember or to understand that orthopedic manual physical therapy isn't just a passive intervention. It's an approach, and it's based on a framework that includes all of the good things, the biopsychosocial, the physiological, clinical decision-making areas that we need to use and understand to perform orthopedic manual physical therapy. So I think all of this has reminded me and the AAOMPT board that the onus is on us to really get that information out there to the public and to the profession. There is an editorial that will be coming out in the Journal of Manual and Manipulative Physical Therapy. It's What's in a Name, perhaps your professional identity and practice. And so we have a call to maintain IFOMPT as the International Federation of Manipulative Physical Therapists.
Dr. Lonnemann, Dr. Paris, thank you both for joining us today on the podcast. It has been an honor and a privilege to have you both here. And most notably, thank you both for all of the work you've done for orthopedic manual physical therapy over the years. We truly and deeply appreciate all the efforts you've put in.
Thank you. It's been my pleasure.
Thank you very much.
This has been a production of the American Academy of Orthopaedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at AAOMPT.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AAOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AAOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aAOMPT.org, which you can find in the show notes.